Welcome to Implementing Health Literacy Universal Precautions. The goals of this series are to explore health literacy challenges, create awareness about these challenges, and promote action for change. This presentation, Implementing Health Literacy Principles, is the first of 3 in the series. In this presentation, we'll review health literacy basics and define health literacy universal precautions. Health literacy is the degree to which individuals have the capacity to obtain, process, and understand basic health information and services that they need in order to make appropriate health decisions. So, where does health literacy come in? As we all know, communication between providers and patients is more complex than ever. Healthcare providers must manage healthcare in the context of offering relationship-centered care, addressing healthcare disparities, and acknowledging the value of health literacy principles to help foster better patient understanding, patient adherence, and quality of care. Older adults, racial and ethnic minorities, people with lower education or income levels, non-native speakers of English, and people with compromised health status are more likely to have low health literacy skills. In fact, education, language, culture, access to resources, and age are all factors that affect a person's health literacy proficiency. But in reality, most people will encounter health literacy barriers at some point in their life. Since we can't tell by looking whether a person will understand what they need to know, it's important that all of us practice what's called health literacy universal precautions with all patients. Generally, universal precautions refers to taking actions that seek to minimize risk for everyone. In the context of health literacy, universal precautions are a set of practice behaviors that are meant to enhance patient understanding of their condition to empower them to make educated decisions about their health care. To help practices implement health literacy universal precautions, the Agency for Healthcare Research and Quality commissioned the University of North Carolina at Chapel Hill to develop and test the Health Literacy Universal Precautions Toolkit. The toolkit acknowledges that implementing health literacy universal precautions in your workplace is a team effort and should include all practice staff doctors, nurses, medical assistants, social workers, schedulers, and others. All those who are communicating with patients need to be engaged in the effort to effect fundamental changes in their practice. There are 4 key drivers to help improve health literacy. First, we strive to improve spoken communication, which is how we mostly communicate with our patients. Are we speaking in a way that our patients understand? This includes the patient's experience at the front desk and with a healthcare provider team. Next is improving written communication. This includes handouts, letters, and other ways we use the written word to provide the additional education and guidance to patients and their caregivers. We also aim to improve self-management and empowerment. We know that helping patients learn self-management skills and empowering them to ask questions is important to improving outcomes. Patients with low health literacy often struggle in this area. And lastly, we strive to improve supportive systems. This recognizes that people with low health literacy may be having trouble in other aspects of their lives that can also affect their health. If we can connect them to other supportive systems and community resources, we may help improve health outcomes. The Health Literacy Universal Precautions Toolkit recommends that to get started, you begin to build your team. First, obtain senior leadership support. Second, engage the whole practice. This is not an individual activity. Everyone in the practice has to understand the issues around health literacy and be committed to health literacy universal precautions. Third, create a guiding coalition. In creating such a coalition, you may have a chair or champion leading the effort. It's important to involve someone from each department in the practice, including clinicians, nurses, practice managers, front desk staff, and receptionists, anyone who interacts with patients. Also, it's very helpful to have a patient or caregiver as a part of this guiding coalition. They often give the clearest feedback of what it's like to be a patient in this situation. Finally, raise awareness to help people recognize this is a problem that should be addressed. We hope that you found this presentation helpful in becoming familiar with health literacy universal precautions and paving the way toward incorporating a mindset of health literacy into your practice. Check out the other precautions in this series to learn more about the tools in the Health Literacy Universal Precautions Toolkit and how you can use them to communicate clearly with your patients. The following program has been created and paid for by Merck Sharp & Dohme Corporation, a subsidiary of Merck & Co. Incorporated, and is intended for healthcare professionals in the United States.